I'm going to talk to you today about a treatment called sulfasalazine. It's a type of medication known as a disease-modifying anti-rheumatic drug, DMARD, that can help slow down the process of some autoimmune conditions. It can be used in dermatology and gastrology, but in rheumatology it is used to treat mainly rheumatoid and psoriatic arthritis, and rarely some other rheumatic conditions. It is also sometimes referred to as sulfasalazine, which is the trade name. It needs to be taken as directed and will be prescribed and monitored by the hospital in secondary care for the first 18 weeks. Our pharmacist will talk about how this works in another separate video. It is important to take care with it and follow some basic safety advice. While sulfasalazine should be safe to take when you're pregnant, all medicines have some risk during pregnancy. So you should talk to your doctor or midwife for advice if you're planning a family. Sulfasalazine can affect the sperm count, and this can affect your ability to father a child. This usually gets better when you stop taking the sulfasalazine again. You should talk to your doctor or nurse to get more information. You may be more likely to develop some infections when you take sulfasalazine, so please be vigilant with any signs of an infection. If you have symptoms of an infection other than a mild cough or a cold, tell your GP or nurse. This includes a severe sore throat, chesty cough, bruising, easily yellow skin or nosebleeds. Keep taking your painkillers, including anti-inflammatory painkillers like ibuprofen, unless your doctor or nurse tells you otherwise. If you're allergic to aspirin, you should not take sulfasalazine. If you're on a medication for diabetes, you may need to monitor your blood levels more closely. Also, check with your doctor, nurse or pharmacist before you take any other medications, including over-the-counter medications. You can receive vaccinations as normal, and whilst on sulfasalazine, we encourage all our patients to have the annual flu vaccine and the pneumonia vaccine. These vaccines are all available for you at your GP's surgery. Lastly, you can still drink alcohol when taking sulfasalazine, but keep it within the 14 units advised by the government. Sulfasalazine tablets are given to you as a tablet called sulfasalazine EN 500 milligrams. You'll start your treatment by taking a small amount of sulfasalazine, usually 1 tablet a day, and slowly increasing it over 4 weeks until you are taking 4 tablets a day. Take 1 tablet after breakfast in week 1, take 1 tablet after breakfast and 1 after your evening meal in week 2. By week 3, you'll be taking 2 tablets after breakfast and 1 after your evening meal, and in week 4, take 2 tablets after breakfast and 2 after your evening meal. This should then continue. Your doctor will advise you if you need to do something different. Swallow the tablets whole with a drink and don't crush them. Try to make sure you take them on a full stomach. Sulfasalazine can have side effects. The main ones are feeling sick and mild diarrhea, mouth ulcers, skin rash, headache and dizziness, occasionally abdominal or tummy pain. It can make you sensitive to the sun, so always make sure you use adequate skin protection. It can stain soft contact lenses orange. It can also make your urine appear orange in colour. This is nothing to worry about, but you must tell your doctor or nurse if you have any of the other side effects. Lastly, it is important for your safety that you arrange a blood test every 2 weeks the first 6 weeks, then monthly for 3 months, then every 3 months. At this point, your GP may be able to prescribe the medication and arrange bloods. There is no mandatory monitoring after a year, but your GP may want to do an annual check. You will continue to be reviewed in rheumatology. The bloods will all be scheduled for you, but it is very important that you attend on or around the dates you have been given. If you are attending FGH or RLI, you can walk into the department for your blood to be taken. Other areas you may need to book an appointment on 01539 715 700. The contact number for the nurses is 01539 716 998, but we do have another list of comprehensive contact details that you can contact us on. We will continue to keep you under regular rheumatology review and hope this video has been helpful.